2.5 million people now have addiction problems. 80% of them have no access to treatment. This is an immense problem. We have to look at the organizations that are providing the treatment. We have to look at the people within those organizations who are prescribing the treatment. JBS has been especially important here in training the people who are providing the services. We've provided guides, we've provided resources, technology assistance, a lot of curriculum development, a lot of opportunities for online training, a lot of opportunities for continuing medical education training, bringing experts in, working with local medical associations. And we also offer technical assistance to really help the institutions do the financing and reimbursement mechanisms to ensure that these programs can be sustained. A new drug came along about 15 years ago, buprenorphine, where you can give it in regular offices, from the doctor's offices. You didn't have to go to special clinics. We have these waivers for physicians. You get certified and you can see up to 275 patients. While we're telling you now, you can extend it to advanced practice nurses and to physician's assistants. And these are really important people in the rural areas to provide services. You have telehealth now so that you don't have to come to the offices all the time. You can create online groups. This is going to really make a big difference in terms of retention in treatment that I think is going to completely change the entire process we've had on how these patients could stay in treatment. Now, one of the most important things when a patient comes in a first time is to get a very good physical examination and a very good personal history. And you also need to do screening. You've got to look very carefully at their history of drugs and screening for drugs within them. But also, really important is to look for comorbidities, that is, co-occurring diseases that accompany often those with opioid use disorder. And with that knowledge, more effective interventions for all. It's going to be an extraordinary renaissance here for drug addictions in this arena, as it is now in cancer and several other diseases.